Good afternoon, everyone. Thank you for joining us today. I want to say a special thank you to Mayor Brian Bowman for being here today. Thank you, Mr. Mayor.
Thanks.
We know that Manitobans are looking forward to a long weekend, a special one, a holy weekend for many Manitobans, and it's a time when many of our families will get together for family dinners and gatherings. This year we want them to be smaller, and I want to start off with an important message for all Manitobans. Please, stay home. Stay home and stay safe. This is not the time for large family gatherings. Je veux commencer par un message important. S'il vous plaît, restez à la maison. Ce n'est pas le moment de grande réunion de famille ou une petite vacance. Don't risk making this weekend's Easter dinner a celebration with fewer people around the kitchen table next year. Do not do that. The vast majority of Manitobans are doing just what the doctor ordered, and that is important. And to them I say thank you. Sadly, there is a small minority of people who are not doing their part, and they continue to ignore the advice of public health experts, of the mayor, of myself, of many, many others, and they put their own health and the health of all Manitobans at risk. So today we are announcing new measures for people who disregard the emergency orders made under the Public Health Act and the Emergency Measures Act. Aujourd'hui, nous annonçons de nouvelles amendes pour les personnes qui ne respectent pas les ordonnances d'urgence rendues en vertu de la loi sur la santé publique et de la loi sur les mesures d'urgence. We want to make sure that there is a deterrent for people who are placing others at risk by thoughtlessly not abiding by social distance rules. There will be active efforts to educate the public, as there have been and as there will continue to be. But at the end of the day, it is apparent that enforcement is needed as well. These are necessary steps to protect all of us. On the enforcement front, we are announcing today an important partnership between initially Manitoba Justice and the City of Winnipeg. We're taking a cooperative approach to our enforcement strategies. Nous adoptons une approche dure sur le point de notre stratégie d'application. To support these efforts, Manitoba Justice is partnering with the City of Winnipeg to create enforcement rules and enforcement units in Operation Safe Apart. These units will be dedicated to enforcing orders, along with providing awareness and prevention, responding to complaints, and supporting community safety officers and bylaw officers. I want to say thank you to Manitobans who have been calling into the city and calling into our information contacts as well in partnering to do the best that we can do and that they can do to assist in the health and well-being of themselves and others. I want to say again, welcome to Mr. Mayor. Thank you for being here, and over to you.
Okay, thank you very much, Mr. Premier. It's a pleasure to be here, and I appreciate the invitation to join you here today. I want to begin just by acknowledging that we're on Treaty 1 territory and the traditional homeland of the Métis. I want to start by giving a really big shout out to the incredible members of our public service and Manitoba's public service who've been working around the clock to keep services moving. And I want to, of course, thank the Premier for his ongoing leadership and efforts. We've all been glued to our TVs and our computer screens watching daily updates from Dr. Brent Rusin and Lynette Saragusa. I want to specifically thank them for their strength, their dedication, and humility during this pandemic. I think they've been working 24 hours a day for the last number of months, including through weekends. We're very fortunate to have them, and I want them to know we're extremely grateful for their tireless work that they're putting in that's providing assistance to Winnipeggers. I'd also like to thank Jay Shaw. He's the head of our emergency operations at the City of Winnipeg's team, and thank him for his ongoing leadership and contributions to today's announcement. He's been an instrumental part of the city's response and deserves a lot of credit for what the work that he's leading. I also want to give a big shout out to all of the members of our community who are staying home, who are practicing physical distancing if they have to go out, and respecting the measures that have been enacted by our provincial government. It's a very surreal time right now that we're all living through, and we're navigating, and we know it's difficult. It's been incredibly heartwarming to see our community pulling together to help each other out and do their part to stay home. And I want to say thank you. And while almost all are doing their part, there is a small segment of our community that's not getting the message. With the Easter weekend upon us, a time that's typically set aside for gatherings in our community, I want to renew the calls to respect the public health orders. The measures put in place by the Manitoba government and the corresponding measures we've enacted at the city are there for the safety of all in our community. Not some, all. For those who are still not getting the message, we've reached a point where the continued violations of these measures needs to stop. As many of you will know, I've been privately and publicly advocating for stronger provincial enforcement measures. I'm very pleased the Premier is announcing these measures today, and I want to say thank you to Premier Pallister. As I've indicated, we're in full support, and we have been, and we're willing to do our part as a municipal government. Starting Saturday, we'll be initiating a community service ambassador program that will get ambassadors out in the community to look for, to help educate, and create awareness to those who are not respecting the public health directions. This includes closed city areas like athletic fields, skate parks, play structures, and picnic shelters. It's important to note these ambassadors will not be handing out tickets. If these ambassadors are unsuccessful in dispersing people from these areas, we'll be utilizing our bylaw enforcement officers to start warning and ticketing those who will be making use of the closed city facilities with penalties of up to $1,000 and the potential of up to 6 months imprisonment. These measures will support and complement the enforcement measures enacted by the province once their legislative changes are addressed next week. The bylaw enforcement officers will likely expand their activities across the city. I also understand, as the Premier's indicated, Manitoba Justice is in ongoing dialogue with enforcement agencies such as the Winnipeg Police Service to enhance enforcement. As many of you know, health is an area of provincial responsibility, but during this pandemic, and as always, we absolutely have to. In fact, our citizens expect us to be working together, and we are. we're demonstrating today our municipal government's prepared to support the provincial efforts in a meaningful way. And of course, we trust provincial government in due course will provide financial assistance to the City of Winnipeg for those health-related services that we're undertaking on their behalf. We don't take this step lightly. However, those who are not getting the message are putting others at risk and undermining the incredible work of so many in our community. And I want to stress that I'm still hopeful that it doesn't come to requiring enforcement. I think we'd all prefer to get full community buy-in, and enforcement wouldn't be needed. But if it is needed, these measures will help keep Winnipeggers, in fact Manitobans, safe. And I want to just conclude by underscoring the messaging from our Premier and from public health officials of the importance to stay home. I know this weekend with Passover and with Easter, a time that we typically get together with family and friends, I want to just underscore the urgent need for people to stay home, find alternate ways of connecting, whether it's on FaceTime or Zoom or just over the phone. Do what you can to protect the health and safety of not only yourself and your family, but our community. And I want Winnipeggers to know that all levels of government, federal, provincial, and municipal governments, are collaborating and are working diligently to protect their health and well-being at this time. Thank you very much. Thank you very much, Mr. Premier.
Thanks, Mr. Mayor, and thanks again, not only to Brian, but to all our local municipal governments and the representatives that are serving there. I think in the midst of this pandemic, there's a danger that we forget that these local governments are delivering services on many, many other fronts in addition to those directly related to the pandemic, and they have stepped up. They have demonstrated their willingness to serve the people of their jurisdictions very, very well, and I think that they've impressed all of us. Speaking of impressed, I want to say also for the record that we have had virtually no complaints about small businesses, and I want to emphasize in particular our thanks to them. Many of these small businesses are suffering tremendously right now. Many who work in them have lost their jobs or have seen reduced hours, and paychecks matter to people. And so for all of us, we need to appreciate and I think say thank you to the mostly family-run small businesses around our province. The reality is they're our foundation of our economy, and they are in distress right now, and so thank you to them for stepping up and helping. They are tremendous. We have taken some significant steps specifically for small businesses and their employees and their families in the last number of days and weeks, and I know that Manitobans support those measures because they understand how critically important small businesses are to our province. So we are going to continue to do so as we invest more today and tomorrow in very significant ways in things like procuring online, or not online all, but procuring important frontline goods and services, and also making significant additional investments, as we announced yesterday, for example, in research. In saying this, I am making sure Manitobans understand that although we are, all of us, up to our armpits and alligators right now, we are not ignoring the longer term. And we are very, very interested in making sure that we make the steps, take the steps necessary to protect people today, but also to protect our province and our services as we move forward as well. We have made literally hundreds of millions of dollars available as a province in just the last 3 weeks, and I would say it is very clear that next week we are going to have to make even more resources available, and that will happen when we reconvene our legislature on Wednesday, I anticipate. Our House leaders are in discussion as we speak, so there'll be more, I expect, to report on that later today. I've used the analogy before because I come from a sports background. You don't learn about your team so much in easy times, but you do learn about your team in challenging times. And what I'm learning is that our people in Manitoba want to work together and are. They're stepping up and they're demonstrating the quality that I think is not exclusive to Manitoba, but I think very much a source of pride for us in Manitoba. We're stepping up and we're helping each other in the thousands. We're volunteering. We're doing the things necessary to keep each other safe and ourselves safe. And so today is a bit of a sad course of action made necessary by the very, very few in our province, to the 99th percentile and plus. I want to say thank you, and I know the Mayor would agree 100%, and say thank you to Manitobans for their wonderful qualities. We look forward to taking your questions.
Thank you, Mr. Premier. A reminder to reporters, you have a primary question and one follow-up question. From the Canadian Press, Steve.
Oh, hi, Steve Lambert from the Canadian Press. We just got handed a release that said the fine is about $480-some for individuals and a little over $2,000 for businesses. But the mayor just said the fine was $1,000. So I'm just seeking some clarity as to what is the set fine limit and whether there's a range or it's a preset amount.
Sure, I can start with that. I mean, yeah, thanks very much, Stephen. It's good to hear from you. So we're using our existing parks bylaw to empower our bylaw enforcement officers to impose fines of up to $1,000. There's other levers that the province currently has that allow for other kinds of enforcement. Our enforcement at present can occur on city-owned spaces. And so that's where the collaboration with the province has been incredibly important leading up to today, and why doing the appropriate due diligence so that there was a thoughtful plan that was coordinated between the province and the city of Winnipeg was so important. There are other bylaw officers at the provincial level that have different powers in different spaces, and that's what we've coordinated.
Okay, and as a follow-up question for both of you, have you given any thought, in some jurisdictions, parks are closed, campgrounds are closed, our camping season starts in just under a month. So for both of you in your respective park spaces, are you considering closing them altogether?
We've actually launched, we're launching a number of committees of study to prepare for the best, as well as doing the initial responses of responding to what is less than the best right now. So in that, we have already a committee underway led by MLAs Wayne Owasco Rick Wochuk, that will be working with industry representatives and private sector as well, owners, because we have many private sector campgrounds around the province that will be profoundly impacted as we move forward, in consultation with Dr. Roosen to advise them on planning as we move forward week by week and into what we hope will be a wonderful spring and summer. So that planning is underway right now, and I can only assure Manitobans that it is not exclusive to that industry. We are also working with chambers of commerce, business associations. The Manitoba Federation of Independent Business has been wonderful in supporting us with ideas and suggestions as well. I could mention them, and the Business Council of Manitoba also has provided us with very good input, and we're working in partnership with various trade and business associations as well to position ourselves so that as improvements are made, as better outcomes occur, we can strategize to make sure Manitoba is on the rebound economically and socially as well.
I can maybe just add to that in terms of city parks. The short answer is yes. I mean, there's been consideration of a lot of administrative changes. We're hoping that that's not necessary because, you know, it's the catch-22 governments are in right now. On one hand, we're saying go home, but on the other hand, we're trying to provide space so that when people do need to leave, they have safe spaces that they can spread out. And so we've closed a number of streets, for example, that are typically just closed on Sundays during the summer. But our parks also, we want to let people have space so that they can physically distance from each other. On the other hand, we've closed playgrounds and skate parks, places where we know people congregate in close proximity. And so we'll continue to monitor. Obviously, the community service ambassadors will be out this weekend, and they will be educating, and they'll be proactively looking for groups or gatherings in our parks and elsewhere in the community where people are not respecting the physical distancing orders from the province. And so, you know, the vests that people, these ambassadors will be wearing will be blue. I've assured the Premier, and I want to assure the media, that these are not blue because of any party affiliation. There's a lot of orange vests out there at the regular times, but these are city vests, so they'll be very visible wearing safety vests that are blue, and they'll be out there conducting themselves in a safe manner in our parks and elsewhere in the community.
I should also add to the question that parks facilities will be communal facilities like washrooms, play structures and so on will be closed later today.
From City News, Jonas.
Good morning, guys. Jonas Gilbart, City News. Just confirming, these new enforcement measures will only apply to groups larger than 10. The current Public Health Act enforcement that is in place. This isn't like a family out for a walk or anything like that.
No, let's be clear. We're not doing anything here except adhering to the recommendations from the public health advisors that we have and that we respect very much, and the Mayor thanked previously, and I thank again. But we have to understand, too, that we're dealing with a pandemic of historic proportions that is unprecedented, and so there may be necessary changes or modifications in the interests of public health as we move forward.
And as far as the logistical timeline, there was a mention earlier of maybe having to pass new laws. When will this actually be on the books here in Manitoba?
Wednesday, with the cooperation of the opposition parties, we'll be moving to do some codification, clarification further on this issue. But of course, the deterrent measures we're talking about today are going to continue to be important. I would also emphasize, though, that to the 99.9 percentile, the education that the Mayor emphasized earlier is the key. Exchanging information with Manitobans and making sure that you repeat those messages about proper conduct, about proper hand washing, about proper social distancing, and you name it. That's the preventative measure that works. This is a secondary measure made necessary by those who fail to understand how important they are to themselves and to others around them.
I'll just add to that, in terms of city, I mean, the fines and the penalties that can be imposed for those that are not complying with public health orders, specifically where we've closed playgrounds, where we've closed skate parks, that's effective immediately. And so as of right now, if folks are not respecting those closures, they can be penalized up to $1,000. Worst case scenario, and I would be shocked if this is ever necessary, you know, there's imprisonment up to 6 months. But as the Premier's indicated, kind of that first level is really education, and that's where media come in, and I want to thank you for all the reporting and work you are all doing, and those that are tuning in. It's really getting that message out. And so the ambassadors, they will be out in the community on Saturday and beyond, and we'll work collaboratively with the province following their legislative actions at the legislature next week to ensure that we are as aligned as possible and we're working collaboratively to support their efforts. And that's what today is demonstrating.
From the Winnipeg Free Press, Carol.
Hi, Mr. Mayor. Hi, Premier. It's Carol Sanders at the Free Press. I'm wondering about the ambassadors. How many of them will there be? Will they be multilingual, or what can you tell us about the ambassadors? How many? Who are they?
The ambassadors are we're starting with community services staff, but we're also redeploying staff within the public service. And so our corporate communications can be available to you after this press conference and later today to provide you with a little bit more granular detail. But there'll be a sizable number. If my memory is correct, we are expecting up to 48 to be deployed. And it could be more than that throughout our community. But again, if most Winnipeggers, as they're doing right now, are staying home, we're hoping that they don't have a lot of education that they actually need to do, but they're going to be out there beginning Saturday.
As a follow-up, Mr. Premier and Mr. Mayor, you've had your differences in the past. How would you describe your ability to work together in this fight against the pandemic?
Well, it's a love-in.
Yeah. I'll just say, you know what, we both have the same names, so there's a lot we share, and we've shared since birth. And so, you know what, we've done some good work together before this pandemic. We're going to do a lot of good work afterwards, and right now, our officials and we individually are doing our part to provide the leadership that our community expects. And I want to thank the Premier for his leadership and his efforts and that of his officials. And we're going to be there to support each other right now, as all Winnipeggers are doing with each other.
I just would have to say, though, in fairness, Carol, if two people are always thinking exactly the same way, one of them isn't thinking. And you have two representatives of the people here who agree on most things, and when we disagree, we do that when we talk to each other. So I would just have to say, too, that when we agree, I rarely ever have seen that in any media publication. I'm not sure why, but that would be, I think, something you could ask yourselves.
There's so many places I could take this. How long do we have?
From Global, Brittany.
Good morning, Brittany from Global News. Mayor Bowman, you said up to 48 community ambassadors could be used during this process. I'm wondering if either of you could tell us how many bylaw officers, conservation officers, people of that regard could be out issuing tickets when that is what happens.
I'm going to address that, Brittany, by saying that for security measures to work, it would be unwise for either of us to get into specific details about any aspect of this. I would tell those who are so disrespectful of the rest of us to understand that they'll be everywhere, in every neighborhood, everywhere you are, and that you'd better change the way you've been behaving, and you better do it now, or you're going to be lighter in the pocketbook very, very soon.
And my follow-up would be, at what point are we going to start seeing police officers be used in this regard? Is that something that is going to happen at all?
I can just say I understand that there's dialogue between Manitoba Justice and our Winnipeg Police Service. I spoke with our Chief of Police earlier today. I spoke with him yesterday as well, and I want to thank him and the members of our Winnipeg Police Service for their efforts. They will engage in discussions that may impact operations with Manitoba Justice directly, and that's not something that's being directed by City Hall. Certainly today's announcement isn't empowering or making any requirements to them that would impact operations, but they will continue to have the dialogue with Manitoba Justice and follow developments, of course, next week at the legislature. And certainly I want to just take this opportunity to thank them for their efforts. And again, that is a kind of an additional level that hopefully isn't necessary. The education is tier 1. Tier 2 is bylaw enforcement that both the province and the city are announcing today, and law enforcement at that level is something that would be extreme, and I hope it's not necessary.
From the Brandon Sun, Bud.
Good afternoon, Bud Robertson, the Brandon Sun. Hello, Mr. Premier. My question is, I can see how this would work in Winnipeg and Brandon, other large communities that have bylaws. How do you see this working in small rural communities, enforcement of this?
Well, but I would say this, the structures we're going to be clarifying even further in the coming days are designed to assist rural communities as well as the city of Winnipeg, as well as northern communities and Indigenous communities. And so the question of how effectively that can be done in a very, in a very small community like you and I grew up in is a fair question. I would remind citizens, though, of the province that this is a shared obligation too, in particular not on the policing side, but on the education and information side. And if you see people that are being disrespectful, you have every right to raise the issue with them directly. And if you see, for example, I've said this before, we haven't had cases, our business community's been wonderful, but if someone is flaunting the rules, a business person, you have every right to report that to us, but you also have the right to tell your friends that that's not a place that you should be honoring with your purchases. These measures are in addition to what any government can do, and in some cases I think probably at least as effective or perhaps more effective than we can do. We're all in this together. Every one of us is impacted, and we will beat this thing by facing it together, and that is essential at this point, and it always will be.
I'll just...
Are you expecting the I'm sorry, are you expecting the RCMP to...
I'm sorry, I cut you off, but if I can maybe just add to what the Premier said, and sorry to have cut you off there. What I'll just say is, introducing measures like fining people up to $1,000 or even discussing possible imprisonment up to 6 months when it relates to playgrounds and skate parks is not something any mayor or premier, for that matter, wants to announce. This is not what you aspire to do when you enter public service, is to tell people not to go to public playgrounds, places of joy and places of community. And so these measures aren't being done to gain popularity or anything like that, because they won't. But if you have to tell people in your community, if you see people in a city-owned park or play structure where they're not abiding by the public health orders, and you want to blame either Brian, do it if it's going to help protect the health and safety of our citizens. And that's where I want to amplify what the Premier is saying, is there's a role for all of us, and the vast majority of Winnipeggers are acting very responsibly. They're in their homes, they're respecting the health orders, but they can play a role also if you see something that you know isn't being recommended or ordered right now. You can respectfully and engaging in physical distancing, you can do your part. And we're really calling on everybody. This is a shared effort, provincial, municipal, and citizen-centered way of battling a virus that doesn't care about jurisdictions, doesn't care about age, demographics, all those things. I mean, it can impact all of us.
Okay, and my follow-up to the Premier was, the provincial measures don't mention imprisonment as the city. Is that something you're not considering then, imprisonment?
We're serious about these deterrents. We're saddened by the necessity to pursue them. We're committed to doing what is necessary to protect the health and well-being of all of us, and I would re-emphasize the earlier comment in respect of the shared obligations we all have to do what's right for each other. If you have something to report, we have been privy to good information from citizens, and we will be focusing initially at least some of the efforts on deterrence as a response to the suggestions that Manitobans have given us, call Manitoba Government Inquiry Line at 204-945-3744 or email at mgi@gov.mb.ca. We appreciate your help. Thank you.
From CJOB, Diana.
Good afternoon, Diane from 680 CJOB. I know these measures you are announcing today are for policing things like gathering sizes and using playgrounds that are closed, but will ambassadors also be checking for people who aren't social distancing acceptably? So if a group of 2 or 3 people are walking in a park together, will ambassadors be asking, are these people members of the same household, or is it just going to be those larger groups? Because I know obviously the messaging right now is not to gather with people outside your household.
Short answer is they will be trying to educate everyone citywide, and so our bylaw enforcement efforts will be focused on city assets and city properties that are closed. But our this community service ambassador team will be educating and helping educate people citywide, including in parks. And they're also, I want to thank, Jay Shaw has been working with our team to ensure that their safety is being protected when they're out in the community. And so they will be prepared with scripts and educational information that they can provide to people. And I'm sure if you have further questions on that, we can follow up with you afterwards.
And the province and the city are coordinating that effort, so those are approaches that will be relatively uniform regardless of jurisdiction.
And my follow-up, Mr. Premier, you mentioned that small businesses have not been the subject of any complaints with social distancing. What about larger businesses? Are you able to speak to any kind of education or enforcement the province has had to do with larger businesses so far?
I can tell you that the response from the business community, large, small, middle-sized, has been remarkable, and that we're very thankful. But of course, these penalties will be relevant to businesses that change that approach. And I will say this, it is our hope, of course, that we can move into a recovery stage. And so looking ahead, it is also important that these deterrents continue to be followed, because there is ample evidence elsewhere that there's been a ripple effect, even when COVID has been supposedly flattened, that it can resurge. And so we have to bear that in mind as well. We're not out of the woods here yet. Our numbers give some people very good hope and optimism, and that's good, and that's deserved. We want people to be hopeful. We want people to be optimistic. But based on the actual realities elsewhere, we need to remember that we're in a marathon here. It's not a sprint, and we have to keep doing the fundamentals properly, as we all emphasize day after day. So follow those fundamentals, protect one another. We'll get through this, but we need to be steadfast, and we need to work together now.
From the Winnipeg Sun, Josh.
Good afternoon. This is Josh Aldridge with Winnipeg Sun. The delay on a lot of this sounds like it's been making sure that there were no constitutional issues on it. What were some of the constitutional concerns you had? And to that point, is there going to be an appeal process for anybody fined for failing to maintain social distancing? And what does that look like when a lot of the courts are kind of shutting down and only doing urgent matters? What's that process going to look like?
Okay, let's be frank. We'll have lots of time to do all the process debates on everything we're doing right now in the middle of this pandemic, but we're focused on making sure people don't get COVID, and we want people to not give it to each other, and we want people to respect each other. So let's keep our eye on the ball right now. That's what we're going to do. On the issue of constitutionality, I will simply say to you, Josh, I have tremendous belief that our charter and its freedoms are precious things, and we are always reluctant, as the mayor alluded to earlier, to infringe on the freedoms of law-abiding people. But what used to be normal and acceptable a couple of months ago in our city and province isn't now. And so we have to understand that, and we have to change, and we have to do it now. And we'll save lives doing it. It's not every generation that has a chance to save lives, but we have a chance to do it now. if we respect each other, and if we're willing to adapt and to listen. So that's exactly what these measures are about today. It's about governments adapting, and it's about people adapting right along with us. And most of you are, so thank you so much for doing that.
Okay, my follow-up is looking at these ambassadors and bylaw officers. Are they going to be armed with PPE, or are they going to have any extra protections for themselves out there if they're out there dealing with the public? And there could be some confrontations if people don't like them coming up to them and educating or trying to enforce these measures. What protections are in place for them?
I'll let Jay Shaw speak to that, and our corporate communications can provide you with that. That has been a topic of conversation, and I've been assured that their health and safety is being protected in the deployment. And so we can provide you with additional detail. I know, even on the issue of, this morning I was speaking with Jay Shaw and asking, okay, are they going to be handing out, for example, written information? The short answer is we're trying to avoid that, because then you got to actually get within the physical distancing requirements in order to do that. So that's why the primary method of communications for those in person will be just be verbal, and it will be from a safe distance. And so, but like I said, our corporate communications can provide you with a little bit more granular detail to that question afterwards, if you'd like.
From CBC Radio Canada, Patrick.
Bonjour, Patrick Foucault from Radio Canada. Will we make sure that Winnipeggers who speak French and want to be approached in French, will they be able to speak in their preferred language with the ambassadors and the bylaws officers?
Toujours. Certainement.
Will they be, so does that mean every ambassador will be bilingual? Is that what it means?
No, it doesn't mean that. But it does mean we're very sensitive to the multicultural and ethnic nature of one of the most diverse parts of the country of Canada. And so, of course, in the initial phases and on an ongoing basis, we're respectful of that reality. As far as making every language service available, that is unrealistic as a proposition right now, but it is always in our mind. The respectful nature of the relationship we have with the people of Manitoba is very important to us.
Thank you, Pallister. And I'm not sure if the next answer has been answered. If so, I'm sorry, I apologize. But let's say we have this weekend someone who suspects its neighbor is holding a party with more than 10 people. Are you recommending they call the police to tell on their neighbor?
I'm recommending they call the Manitoba Government Inquiry Line at 204-945-3744, or email mgi@gov.mb.ca.
From 102.9 CHTM, Navi.
Good afternoon, Navi Ball with CHTM. Mr. Premier, I know you've mentioned multiple times that it's important for people to stay home, but are there still concerns about people traveling either within the province or outside the province for the long weekend?
Most certainly there are, Navi, and this is why we'll continue to urge people to do the right thing, the respectful thing for themselves, for others. I would suggest to family members who may be thinking that it would be fair to exclude themselves from such suggestions or rules. I would ask them to ask themselves how they would feel if a few weeks from now one of their family members was to contract COVID, and to make sure that that is not something they allow to happen as a consequence of a short-term decision. So this is a hardship, I understand that. Many families are suffering, many families are stressed, many families want to get together desperately right now, especially now. But to protect one another is our first and foremost obligation, so please, adhere to these recommendations. Do this. We'll have much to celebrate in the years ahead. Don't destroy the chance for such a celebration with a short-term decision that could be, frankly, very, very dangerous or fatal to someone you love.
And to follow up on today's announcement, I know it's for Winnipeg, but in the coming days when you announce the rural and northern municipal enforcement measures, would there also be a similar fine system, or would that be dependent on each individual municipality's bylaws? How would that sort of work?
No, Navi, that'll depend on provincial rules to a great degree. There are some potential different rules within municipalities, that's true, but the relevant guidance here is uniform, and we will endeavor to make sure that it, as much as possible, is uniform throughout the province naturally, because that is how we'll generate greater respect for adhering to the rules and the consequences of them.
From CBC Manitoba, Bart.
Bart Keys of CBC. Mr. Mayor, the redeployment of dormant community service employees as community ambassadors for this purpose makes sense. At what point, as this pandemic continues, will the City of Winnipeg begin to contemplate temporary layoffs for staff that are not working or able to work?
Well, Bartley, good to hear from you. I know other municipalities have acted pretty quickly in terms of layoffs. I'm pleased that to date we have not laid anyone off, and our first preference, of course, is to redeploy, and that's what's occurring here today. I know a number of our staff, with the cooperation and the collaboration with CUPE, have been redeployed to places like Winnipeg Harvest. And so there's obviously a lot of work that has to happen in the coming weeks with the appropriate dialogue and oversight of council. But we're certainly we're not announcing anything today, and my hope is that we don't have to go there.
Okay, and also, Mr. Mayor, could you please clarify? I mean, you have using the parks bylaw for up to 1,000. Are you saying that if there are violations outside of parks, it will only be the $200 limit, and if it's on a park, it'll be 1,000? Can you clear up the confusion within the City of Winnipeg about the potential fines?
Sure, and corporate communications can provide you with a little bit more detail, but our bylaw enforcement officers have power right now under the existing bylaw, and so we're leveraging that as best we can. The ambassadors are going to be deployed citywide, however, even in areas that could potentially even be provincial public spaces. So schools is a good example. Had a member of council raise that issue with me this morning, and they can get out there and they can educate, and that's our first preference. But we can get you some additional detail on the specific bylaws and details that you're asking for today.
I could add to that, Bartley, if you like. We'll bring formalization of this forward next week. What we're suggesting is a two-tiered structure which would have individual fines at approximately $500 and corporate fines at significantly more.
From CTV Winnipeg, Jeff.
Oh, hi, gentlemen. Jeff from CTV. And following up a little bit on what Bart asked, I do have a little clarification question here. I just want to be clear. The parks bylaw, when we're talking about fines, will be used when we're talking about city assets like city parks. I get that. But for everything else, like a school playground, maybe a church congregation, or what the provincial fines that's what will be levied for everything outside of city assets. Have I got that right? Is it that separation?
500 for individual, and I think we're looking at 5,000 for corporate beginning next week. I'm sorry, 2,500, not 5,000 for corporate.
Okay, and why, I guess, a strategy from within the City of Winnipeg, and then one from the province, and then why not just the province have the fines and the strategy overall? Why is there this partnership here? Why not just the province? Here's the set fines for everybody.
Well, because we're going to be implementing this with the cooperation and support of other parties in the House next week, because the mayor is forced in the interim period to work with the existing rules as they are, and I've given you the clarity around where we're going to go as of next Wednesday.
I'll just add to that, Jeff. I mean, we're both leveraging the authority and the levers that we have right now to act in a timely way, recognizing that there's additional work that's required legislatively. But you know, what we're trying to do is primarily educate people, and so hopefully the sticker shock of $1,000 and potential imprisonment is enough for people, the very few people who need to get this message, to get the message today. And of course, CTV and others can help broadcast that today. But you know, we're doing the best we can in a timely way with the levers that we have accessible to us. And the dialogue is going to continue. We're going to continue to work collaboratively going forward, not just on enforcement, but on other issues where governments have to work together, and we're doing that.
In closing, I just want to say thank you again to Mayor Bowman for being here today. I really appreciate his presence here today and his cooperation as we move forward. I also wanted to acknowledge that today is the 103rd anniversary of a defining moment in Canadian history. That is the Battle of Vimy Ridge, and I want to say a special thank you to all our veterans, all our current service people, our sincere appreciation for what they've done for our country. And I want to say to those who may not be students of Canadian history that are thinking that they don't matter and that they can avoid any responsibility for looking after themselves or others in our province, to maybe just Google Vimy Ridge and see if they can find a little inspiration. Every generation doesn't have a chance to save a life, but Manitobans have done that throughout our history. They've given a lot for us and for each other and for our country. And now you have the chance to do the same, so do it, and don't be lighter in the pocketbook. Behave accordingly, respectfully. Happy Easter, happy Passover. See you next week.
Thank you. Merci, Miigwech.
And to you.
Thanks, everyone.
We are increasing our testing recommendations. First responders, such as police officers, firefighters, who are showing symptoms are now also going to be prioritized for testing, starting today. Current testing parameters include people with symptoms of respiratory illness who have traveled outside of Manitoba in the last 14 days, close contacts of a confirmed case, healthcare workers, all patients admitted to hospital with respiratory symptom, lab workers who may have handled COVID samples with symptoms, individuals who live or work in the north or remote isolated communities or any congregate settings. Public health orders have been in effect, and yesterday public health inspectors in Brandon issued an emergency health hazard order yesterday to a tattoo business in Brandon on 12th Street that was continuing to operate despite the public health orders. This was the first health order issued. No fine has been assessed at this time. While the majority of businesses contracted by public health have complied with the order and have done their part to limit the spread of this virus in the province, we know that there are some businesses, some Manitobans that have not got the message about how important this is. And so this is an example of that these orders are in place and they will be enforced. We need to get the message out to all Manitobans that everyone needs to do their part to limit the transmission of this virus. And if we need to issue orders, if we need to issue fines, then that will take place if that's what we need to do to get the message across. We need to continue to take these steps to make a difference in our cases going forward. We cannot let our guard down at this time. Certainly these last few days showed relatively low numbers in Manitoba, but you don't have to look far in our neighboring jurisdictions to see case counts climbing. We've seen deaths related with COVID-19 in Canada. And so we need to keep our guards up. We need to double our efforts in order to maintain the flat curve right now in Manitoba. This is an important time upcoming for Manitobans. We have a long weekend. We have holiday celebrations, Easter and Passover. In addition to that, we've seen some relatively low case numbers in the last few days. I want to make it very clear to Manitobans that we cannot now get together for family dinners. Now is not that time. We need to adhere to physical distancing strategies, and the strong message is stay home. Staying home does not mean going to your cottage. Staying home does not mean going to faith-based organizations. Staying home does not mean taking the entire family out. Staying home is staying home. Avoid leaving your house only for essential activities, doing so alone if you can, but adhering to strict physical distancing strategies the entire time, washing your hands at all times. All travelers returning to Manitoba are required to self-isolate and monitor for symptoms 14 days after they return. International travelers are required to do so under the Federal Quarantine Act with strict penalties for contravention. This also reiterates the importance of canceling or postponing all non-essential travel. Now is not the time to travel. Now is the time to stay home. We know that these orders and all of our strategies in place have been challenging to Manitobans. But we also know that many Manitobans have been doing their part. And we can see from hints of these numbers that these efforts, these difficult efforts, are paying dividends to us. And if we loosen up now, we can start seeing the climb of our numbers, start seeing the climb of severe outcomes. So now is a time we need to double those efforts, keep these numbers down, and we'll keep moving forward as Manitobans. This virus is in all health regions of Manitoba. We cannot assume that it's not affecting the place where you live. All Manitobans need to take these precautions. Do not look to see if there is a case reported in and around you. Right now, all Manitobans need to stay home, practice physical distancing at all times. You cannot assume this virus is someplace else. It's everywhere in Manitoba right now, and we all need to do our part to limit the transmission. Like I mentioned, this weekend I feel is critical, as are the next couple weeks. We may be seeing nicer weather. We know there's holiday traditions, Easter, Passover, and we've had the combination of some low numbers being reported in the last few days. This time is critical for Manitobans. Do not attend family gatherings for Easter celebrations. Stay home, stay connected. Need to stay connected with the people we love and certainly vulnerable people. Do so virtually, but do not host a family gathering this weekend. At these family gatherings, we know the virus can be transmitted. We know it can be transmitted by people showing very, very mild symptoms. Sometimes symptoms that are so mild they're undetected. Do not host a family gathering. Stay home, protect yourselves, protect your loved ones, and protect all Manitobans, including our frontline healthcare workers. You know, during these difficult times, people are still experiencing other health problems. COVID-19 is not the only health issue right now. I want to encourage Manitobans that if you need care, medical care, do seek it. Our hospitals are safe. Our healthcare workers are experienced and dedicated, and certainly it is safe to attend for medical care if you require it. Call HealthLinks if you're not sure, but do not be afraid to attend medical care if you require it. Stay in contact with your healthcare provider. A lot of it can be done virtually right now, but under the advice of your healthcare provider, if you need to be seen, you can be seen. Please do not avoid being seen for urgent or emergent medical conditions. Call HealthLinks. If it's emergency, call 911. Our healthcare system is safe for people to use. You know, on a related note, our healthcare workers are at the front lines, keeping Manitobans safe. but we still see issues with fear and stigma. So there's examples of people presenting to medical care who aren't forthcoming about their recent travel or even their symptoms or even that their contacts to known cases. So be assured you're not going to be denied care in these circumstances. It's just that our healthcare workers need to be able to protect you and themselves. So please be forthcoming with your travel history. Please be forthcoming with your symptoms. And please be forthcoming if you are a contact to a case. Our healthcare workers need to know this. You're not going to be denied care, but you're just going to be offered the proper care. So I want to continue to advise Manitobans to seek out credible information. These are concerning times, but fear, stigma is not going to help, right? Credible information and our actions are going to help, and in fact, they may be helping if we look at these numbers, but we can't let up at this time. So visit manitoba.ca COVID/19 for up-to-date information. There's an online screening tool for COVID-19 there as well. So I think that as we look at various models, and Manitoba is currently working on our modeling and hope to have some information we can share for Manitobans in the upcoming weeks. We look at our case counts. It's showing that we are not helpless against this virus, but it does take action, and it takes a lot of action. A lot of Manitobans have stepped up. These are challenging times, but these are the type of things we need to have in place if we want to limit the impact of this virus in Manitoba. So thank you all for your help and support with this. Thank you to our healthcare workers who are on the front lines. And I'll turn it over to Lynette now.
Thank you. Good afternoon. So we've been talking a lot in the recent days about the challenges that we, just like all other jurisdictions right now, are facing with regards to PPE due to a variety of issues, including border closures and distribution disruptions. We have mentioned previously that we are now working with over 600 vendors to secure the inventory that we require to keep our staff and patients safe. And we have developed guidelines for the safe, extended use of PPE in appropriate settings and circumstances. These guidelines are being implemented across all regions and healthcare settings, with areas implementing them as they are able. We will continue to support the regions and healthcare facilities in these efforts while recognizing ongoing challenges with supply may require that we extend the timeline for implementation in some areas beyond next week. We continue to work with supply chain partners and government to identify options to enhance our supply and are in ongoing discussions with infection prevention and control as well as occupational health experts around our ability to conserve our resources where safe alternatives may exist. We are also working with health regions to identify service changes that may be implemented safely. We are very, very encouraged by the efforts of local construction, automotive, and other companies who have been answering our calls and donating much needed supplies that they agree with us that those supplies are better in the hands of healthcare providers at this time. So we continue to ask all Manitoba businesses to consider what they might be able to donate in keeping our healthcare professionals safe. And we are similarly encouraged by the efforts of local manufacturers and companies who are innovating and retooling to make us certain medical supplies closer to home. Today, we are so pleased to share the news of Canada Goose's plans to ramp up domestic production of PPE for frontline healthcare workers across the province. This includes making 100,000 reusable medical gowns at cost for healthcare workers here in Manitoba. This is fantastic news, and we thank Canada Goose for this partnership. Okay, and we'll go back to providing some stats for you because I haven't given those for a while. So in the past week, HealthLinks has received 13,434 calls. The daily wait times varied from a low of 12 minutes on Tuesday to a high of 28 minutes last Saturday. Our online assessment tool has seen more than 405,000 web views since it launched more than 3 weeks ago, including approximately 45,000 views in the past 7 days. Dynacare continues to support us in making calls to those patients who had a negative COVID test. And in the past week, they made 5,250 calls. There are some challenges that they've been having in connecting with some people. So if you are waiting for a result from Dynacare or a negative result and you haven't heard for a couple of days, you can call the provider who took the sample in the first place, and they should be able to help you find your results. But for the most part, the majority of people are contacted through Dynacare. And I would also just remind those who test positive will get an expedited call from public health to walk you through what the next steps are in terms of managing any symptoms and isolation. I also wanted to make note of some scheduling changes that are occurring at several of the testing sites over the long weekend. So locations in Brandon, Dauphin, Pine Falls, and Ericsdale will be closed on Good Friday. The Mount Carmel Clinic in Winnipeg will be closed Friday and Sunday. And Winnipeg's 3 other locations will operate as regularly scheduled throughout the long weekend, including the assessment clinic at St. James Centennial Pool. Sites in Thompson, Flin Flon, and the Pas will be open daily throughout the weekend with hours from 1 till 5. And finally, locations in Selkirk, Portage la Prairie, Steinbach, and Winkler will be open as normally scheduled throughout the weekend. So to see the hours and operations of the addresses of these clinics and sites, please go to manitoba.ca/COVID-19. Also an update, the COVID-19 Case Contact Center is now up and running. The center is providing additional support for public health investigators who are doing the contact tracing. Much of this work involves doing daily follow-up calls with contacts of positive patients to see if they have developed any symptoms or are having any challenges with self-isolating. And this frees up the public health officials to spend more time on investigations, which will, as the numbers increase, become more challenging to keep on top of, but with this additional support, that will be very helpful. The center did a soft launch yesterday and focused on helping contact tracing in the Prairie Mountain Health Region. And as of today, they've expanded to the rest of the province. As Dr. Roussin noted, we are reminding Manitobans to seek medical attention when it is required. This also includes the Sexual Assault Nurse Examiner Team, which we call SANE, which is located at HSC Winnipeg. Sadly, we know that the number of domestic and sexual violence is not eliminated during a pandemic, and we want Manitobans to know that help remains available to them. The SANE team is comprised of forensic nurses who will see victims of sexual and domestic violence within the past 10 days, or who have experienced it within the past 10 days. This 24/7 program sees all genders and all ages of individuals living in Winnipeg, as well as individuals 17 years or younger throughout the province. To prevent the spread of COVID-19, appropriate precautions are in place right now to protect both the patients and the staff working within the same team. And this includes screening patients when they arrive and having staff wear personal protective equipment. Individuals can also call ahead before arriving to reduce their wait for assessment. So they can call 204-787-2071 and ask for the same nurse, and that phone line's open 24/7 if you need it. And my last thing is I wanted to thank the postal workers who showed up to support healthcare workers by doing laps around HSC Winnipeg yesterday in their vehicles and honking their horns. And we've seen support like this in a variety of communities from different groups and organizations, and it is appreciated every single time. It provides healthcare workers with a reminder that they are not alone as they face this challenge. So thank you very much to the postal workers who organized and participated in the parade yesterday. Your support means a lot to all of us. So with that, we can open the lines to questions.
Thank you. A reminder to our reporters online, you'll have a primary question and one follow-up question. From CTV News, Michelle.
Hi, it's Michelle Goulet with CTV News. I'm wondering why you're adding first responders to the testing requirements.
Yeah, so this is just part of the our planned expansion criteria over time. So we're trying to always test those that are likely most at risk of contact. And so certainly the initial testing, those returning from travel, those who are contacts of cases, those admitted to hospital. Now we can, we're able to expand it as a number of returning travelers are diminishing. So expand it next to first responders. Again, the importance of testing in there where the potential of being exposed, but more importantly, the wanting to prioritize testing done to be able to get people back to work if they were ill.
Okay, thanks. And as a follow-up, why wasn't a fine handed out to the tattoo parlor in Brandon?
Yeah, the fine wasn't handed out because they weren't in place at the time that order was issued. So the emergency health hazard issue order was issued, and violation of that order has very stringent penalties under the Public Health Act should it be violated.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. I wanted to clear up something. Now that the province has announced plans to institute fines, does your public health order cover private family dinners, for example? If I have 15 people over for dinner, am I in violation of that order, and am I at risk of facing the newly announced fines?
Well, so the orders would strictly be related to public spaces. So the order itself is probably not in play in that situation. But again, it's what I've been saying from the beginning is we can't police everything. That no Manitoban should wait to see if an order applies to them. In situations where you're having large family gatherings, you're putting all those people that you care about at risk. You're putting other Manitobans at risk. You're putting our healthcare workers at risk. So there may or may not be a fine that can be handed out in every circumstance, but it really shouldn't matter to Manitobans. That behavior is risky. And so I know it's a long weekend. I know it's Easter, Passover, and people are quite used to having dinners like that, and sometimes very big dinners. This year, that's not going to happen. This year, people need to stay home.
And one quick follow-up. The number of active cases has dropped again very slightly today, and I know you were cautioned that this is just a snapshot in time, it's short-term. But what do you take from the fact that, again, today we've seen a slight drop in the number of active cases?
So, I mean, it's certainly things that we want to see. certainly we're happy to see that, but it's way too early in the trajectory of our outbreak to make anything of this. So if anyone was to interpret this that the risk is lower now, is definitely wrong. Our risk right now is high. These numbers are likely to continue to climb over time. And so we need to really make sure that we don't let our guards down. And like I said, this weekend is concerning to me, the timing of it, because this weekend, these next couple of weeks are critical in our battle against this virus. So we cannot have large family gatherings happening. We need to recognize that our efforts may well have been contributing to some of these numbers, but we got to keep it up. We can't let our guards down right now.
From City News, Stephanie.
Hi there, Stephanie Lasuk with City News. Just wondering if we yet have an idea of when the cases might peak in Manitoba.
Yeah, it's a difficult question. We're working on some of our modeling studies right now, and so we hope to be able to share something with Manitobans about that. And so that peak all depends on what we do. So if we keep up our actions and continue to see some benefits from our actions, that peak actually sometimes counterintuitively is going to be stretched out. The further down the line that peak happens, the better it is for Manitobans, because we are having severe cases at a much lower rate. We're not overwhelming our healthcare system. So really difficult to predict, but hope to be able to show some pictures of what that might look at like when we get our modeling all completed.
Okay, and then just a quick follow-up from Mr. Ragusa. The guidelines you mentioned for safe and extended use of PPE, what do those guidelines actually look like?
Well, it takes each healthcare worker through different settings. So if you're working in acute care or if you're working in home care, and outlines what the minimum basic requirements are based on universal PPE. So really, when we started seeing infections among healthcare workers, we upped our strategy so that we were screening when they came in, and we provided protection as they worked all day. So it's related to that, and it's also there was a lot of consultation review with other provinces, BC, Ontario, to look at what were their standards, so that we're quite aligned in that and making sure that our staff are safe throughout this whole process.
From the Winnipeg Free Press, Larry.
Dr. Rusin, Larry Cush of the Winnipeg Free Press. What is the main factor limiting more widespread testing in Manitoba? Is it money? Is it lab and staff capacity? Are there philosophical reasons? What is the number one limiting factor?
Well, the number one limiting factor sometimes fluctuates. So for quite some time it was the reagent, and that certainly is a factor now. Sometimes other supplies like viral transport media or the swabs can be an issue. So I think we're testing the right people right now. We can see that even though our numbers are down, the positive test proportion is also dropping. And so what's driving these low numbers does not appear to be testing volume. But we're expanding over time, but we have to be careful when we expand. If we open it up to anyone with respiratory symptoms, we risk overrunning the lab and then missing, testing very, very low risk people and missing the people who are at the highest risk. So we're testing the highest risk people right now, and then as we work down, we're testing lower and lower risk people to expand it. And so that's why we've moved from our current criteria now to a lower risk criteria, which is now the first responders. And we'll see how test volumes go, and then we can continue to open it up as necessary.
My follow-up is along the same lines, except I'm looking at, you've had patients or staff test positive in at least 4 nursing homes in the city in the past few weeks. Excuse me, there was also an outbreak in one unit at health sciences. I'm wondering, in terms of some of these institutions where you've had positive tests, could you use some of that lab capacity to do tests of staff and patients in these select institutions with asymptomatic staff to help ward off a larger outbreak?
Yeah, so the testing of asymptomatic individuals is really something that's recommended against. In testing asymptomatic individuals often can be negative, even when people are about to show signs and symptoms. And so we're going to focus on symptomatic individuals. We have, as we improve our PPE guidelines in institutions, we're going to see less and less of the risk of transmitting this, even with people who are showing very mild symptoms, which a lot of times this is what we've seen in the healthcare institutions. So we do full contact investigations. Those who require isolation for 14 days will do so. But we're going to focus our testing on those with symptoms, even very mild symptoms, but people with symptoms.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. When it comes to expanding testing to emergency workers, we have seen with Winnipeg Police the number of officers that have had to self-isolate. Would we look at introducing similar screening measures that we've seen for nurses at hospitals where they have to have their temperature taken and go through a series of questions when arriving to work? Would we look at doing something like that for police, fire, and EMS?
Well, we could always look at that. We could, if that was something that they were interested in, we could certainly engage in the dialogue with that. Certainly people within a healthcare institution, the nature of the work allows us to screen the symptoms more frequently. It allows the easier use of universal continuous personal protective equipment. And so in those situations, it's a little bit different in those other occupations. So we'll always be looking at different factors like that, but it's not really the totally analogous.
And my other question was, Prime Minister Justin Trudeau said this morning that we need to be vigilant for about a year and a half, and things won't be back to normal until we get a vaccine. What do you make of that statement, and do you agree with it?
Yeah, I mean, I think we don't know a lot about this virus, but the indications are that we're not going to deal with just a single wave and then the virus will disappear. So it's likely going to be around, and we'll have to have some measures in place to certainly monitor for it. But what is critical is this first wave, is what's going on right now. And so we need to ensure we flatten this curve, that we don't overwhelm our healthcare systems right now. As we get through this wave, we're going to know more about the virus. There may be even pharmaceutical interventions over time. And then certainly a vaccine at some time. So it's critical right now to respond to this wave to ensure we don't overwhelm the healthcare system. But it is likely that we'll have to deal with this virus in some shape or form for the foreseeable future.
From the Brandon Sun, Drew.
Thank you. This is Drew May from the Brandon Sun. Dr. Reeson, can you shed any more light on this business in Brandon that was shut down? And also, how did the province hear that it was still operating?
Yeah, so I don't have a whole bunch of details on the actual operation. What with these type of orders, like I mentioned, in public health, most of our time is just to work for compliance. So I'm sure that this business had been contacted, informed of the requirements, informed of what they're required to do to comply with the order, and likely repeated failures to do so resulted in this order.
And just to follow up for Mr. Gusa, but in terms of personal protective equipment, since there's community transmission happening in Winnipeg, are hospitals there being prioritized over hospitals in other parts of the province, or or is it all equal?
It's all equal, but I would say some areas are at higher risk. Obviously, we know long-term care, the population is older and at risk, so they would be a high priority. Not just in Winnipeg, though, we would take a provincial approach to that, as well as obviously in the acute centers, especially on COVID units, we would want to make sure that they have everything they need. But anytime where you're dealing with blood and bodily fluids, those obviously are the ones that we need to make sure they have adequate PPE supplies. And there's other areas too where it's not such close contact or confined quarters where they're still important, but we have to look at how we can get all the supply out to everybody as soon as possible.
From CJOB, Diana.
Good afternoon, Diana from CJOB. Just a question on kind of the testing numbers and the backlog. I know the positive cases are being notified first, but is there any sort of prioritization with negative results, like our healthcare workers and other first responders getting notified before other people? And kind of what is the backlog on those results right now?
Yeah, I don't think the backlog is very big now. Dynacare has been making, when they first started, 1,200 calls a day. And they also expanded their hours, so they're now working into the weekend to make sure they keep up with the lab. So I don't think the backlog is the problem. I think there are a percentage of people they have been struggling to contact. And so I don't know if those people have changed their phone numbers or they're at work or out somewhere, but if you are one of those people who are expecting a negative result and you haven't heard from Dynacare and it's been a couple of days, then you should call the site where you had the test done or your primary care provider.
And then as a follow-up, you mentioned the COVID case contact center is up and running. How many people are staff getting in touch with on a daily basis, and what kind of capacity does the center have for the work they're doing?
That's a good question. So they're located at Deer Lodge, and there were some Red River community students who came in to help with the surveillance part. And there's also, I believe, 15 medical residents who are working to support if there's any clinical issues that need to be dealt with. And so they're working together at Deer Lodge. They have physical space where they are separated, physically distanced, and they have capacity to grow as this continues over the weeks and months.
From the Winnipeg Sun, James.
Good afternoon, James from the Winnipeg Sun. Just a quick question. Is our testing strategy evolving based on success and failure in other parts of the world or in other Canadian jurisdictions?
The testing strategy is certainly based on where the highest risk individuals are. So we want to ensure that we're using our capacity to test those that are highest risk. So it's informed. It's informed at the national level, and that's also informed from other jurisdictions. So that is where we tend to move. So certainly we'll implement testing strategies that are necessary for any unique circumstances here. But for the most part, it's nationally informed. We're looking to test those that are highest risk, and then as our capacity improves, we'll move it down to lower and lower risk individuals.
Thank you.
From CBC Radio Canada, Ezra.
Hi, Ezra Cuisneau from Radio Canada. Please, would it be possible for you to clarify the exact process to declare a previously infected person as healed, please?
Oh, how we describe someone as recovered, is that the question?
Exactly. From the time he's sick, from the time he's healed, what is the different steps to the point that, okay, now he's completely out of the blue?
Right. So our definition would be 14 days after the onset of symptoms and symptom-free. And so whichever is the longest of that. So usually by 14 days people are symptom-free, we would include them as recovered. If after 14 days they still have symptoms, then we would wait for them to be symptom-free for 24 hours and then cover them and then call them recovered.
Thank you. So I understand that there's no other test to confirm that they're not they're still they're ill. And also, I just wanted to see, is it the same process in different provinces in Canada? Is it the same process all over our country?
That's correct. Yep. So we're not going to rely on tests. The problem with the PCR test, the molecular test that we run, is that it just detects the genetic material of the virus. It doesn't mean it's a viable virus, that it's infectious. So sometimes that test can be positive for weeks after a person is better. So that's not useful. So studies show with viral culture, which does show that, is that usually even after 7 to 8 days of after onset of symptoms, it's very unlikely they'll be still transmitting that virus. So we in Canada, we've put in that safety time. So some provinces use 10 days. We use 14 days for extra safety, but we don't require a test of cure to label somebody as recovered.
From 1029 CHTM, Navi.
Good afternoon, Navi Ball with CHTM. I just wanted to ask about the proposed facilities, temporary facilities in Thompson, Winnipeg, and Brandon. I was wondering if, specifically for the Thompson facility, if it will be open just to those who are admitted into Thompson General Hospital, or will it also be open to patients in the surrounding community as well, if needed?
So, Navi, are you referring to the RFP that the Premier had mentioned a couple of days ago?
Yes.
Yeah. So my understanding is that is an alternative setting to the hospital. And so it would be for patients who are not requiring acute hospital admission, but for whatever reason, maybe it's too risky for them to go home because of the virus or because of the home setting, or they need some prolonged care, like alternative levels of care. So I believe the RFP went out looking for spaces first. So they're trying to identify where are there large spaces where we can use in the future, and then and outfit it with the beds and whatever supplies we need. So at this point, those details aren't determined, and actually my goal would be is that we're preparing for it. But if we can manage within the hospital settings, that would be ideal. So that it's kind of a backup plan that we want to have available to us if we need it.
And just wanted to get clarification on the weekend hours for the test site. So will it be Friday to Monday 1 to 5, or will it just be on Saturday and Sunday 1 to 5, and Friday and Monday are still 9 to 4?
The information that I have is Thompson, Flin Flon, the PA will be open daily throughout the weekend with hours from 1 till 5.
From CBC Manitoba, Bart.
Bart McKee, CBC. Last week you said that this Sergeant Center would be open to deal with disadvantaged people. What's the plan for homeless people right now who are symptomatic, and why is that Sergeant Center not up and running if it is not?
This is 777. Yeah, yeah. I think that that's in the works. I don't know if there is any. I don't believe there's any utilization of it right now. But I think we'll have to follow up. I know that there's a lot of planning that's gone into it, and I think it's was moving forward. So I'll have to clarify whether it's if it's up and ready right now or not.
Okay, thanks. Mr. Gusa, you mentioned that some protective equipment is not getting to all aspects of the healthcare system. What are can you be clear? Do you mean geographic areas? Do you mean personal care homes? Which areas of the healthcare system are not getting their protective equipment right now?
Well, ideally, we would get it out to everybody as soon as possible, and that's still our goal. But as we deal with these challenges in getting our distribution to us, it will affect what we can distribute out, obviously. So it kind of depends. So Canada Goose is now making gowns for us. So yesterday I identified that as a problem. So that will help as soon as those are ready, and I understand we're going to get them as they come off the line. We have also had some good news about gloves. Minister Friesen advocated very strongly on our behalf of all Manitobans, so we'll be getting a shipment of gloves from the federal government. So as soon as possible, we're going to get everything everyone needs out. We're going to get some things. And remember, we have been ongoing shipping supplies out. So some areas may already have a week or two supplies where they're fine. And so it's really a dynamic. I can't give you specific dates, Bartley, because it's literally changing all the time. And we will get as soon as possible to all groups.
We have time for a few more questions. Anyone have a follow to their follow?
Dr. Rosenberg, keep us here. When someone's on intensive care, does that automatically mean they're in a ventilator? And has anyone survived or recovered from a ventilator or ICU?
Right, so not necessarily. So you can be in the ICU without being on a ventilator. We have 5 that are currently admitted and 4 are currently on a ventilator. I don't believe we have anyone that's listed as recovered that had spent time in the ICU, but there has been a recent step down from the ICU to the ward.
Thank you.
Diana from Security CJOB. I guess I wasn't super clear on my question, but Ms. Siragusa, how many people are the folks at the contact center with, in communication with tracing those contacts? How many people are they reaching out to? Do you know?
Oh, I see what you're asking about. How many patients are they in contact with? Or contacts and positives. Do you know that answer?
No,
That's a public health.
Yeah, so we're looking at trying to get a detailed assessment done of, say, depending on all the reports we have in of maybe the first 150 cases, and we can try to elaborate on just how many contacts that typically will allude to. So I don't have a list of how many contacts we have right now, because that certainly changes depending on the cases, and new contacts are identified over time. So we are going to try to have a bit more of a detailed assessment that we can share with everyone.
Okay, is there any kind of ballpark? Obviously, I understand it's very, very changing very often.
So typically our contacts, and it has a wide range. If we look in other jurisdictions, and most of ours, they have a range of 2 to 20 contacts per person. So it's a big range, and it's really really depends on the individual and the circumstances. So I don't have the exact total that we have here.
Okay, thank you.
Dr. Rosen, Larry.
Go ahead, Larry.
Larry Cush at the Winnipeg Free Press. Dr. Rosen, do you have any breakdowns on the type or age or of patient that winds up in hospital yet? Can you make any generalizations? Are they all with underlying health conditions, or are they a specific age group?
Yeah, so I know that we are trying to work on that to get things for you that are a pretty detailed assessment of our hospital-based clients. I don't think I have those exact numbers with me here. There's some we have some breakdowns, but we're trying to work on being able to articulate that in to you to list that age breakdown, the percentage of hospital or the underlying medical conditions, hospital stays, those type of things. But I don't have that in front of me.
That's something you expect to have in the next few days or next week?
Yeah, I'd like to have something that we could provide within the week or so.
Thank you.
Stephanie Osgood with City News. Just wondering if you can clarify, just so that we're on the same page. Not all frontline health workers right now will get PPE or are not expected to get PPE as the supply dwindles or are currently not getting it, and like which areas are they working in?
So yesterday I identified that in some areas, specific areas, we were short, that we had maybe a week or two supply left. So that has changed since yesterday because we have had gowns come in and gloves come in. So they will continue to be delivered to those who are delivering direct patient care, but they will go out as they are available, and we need to look at a strategy going forward because this supply issue will continue to be on top of us throughout this whole pandemic, and you can see it everywhere. People are making or not making or delivering, or it's delivered but it's not arriving. So it's an ongoing challenge. So as soon as we have equipment available, we will be delivering it to the regions. We'll be working with the regions, and we will make sure that those who are at the most risk are receiving their supplies.
So then the universal principle that I think we discussed last week is no longer in effect, that all healthcare workers will be getting it no matter what.
No, that's not true. The universal PPE is part of a way to conserve, actually, because in the absence of any direction, people are using everything. So this provides clear direction as to what you need when. Not everybody needs a gown all the time. Not everybody needs to change in between. If you're working on a COVID unit, you just put your PPE on and you're good. You just change gloves, but you can maybe wear your mask and your glove or your gown throughout the shift. So no, it's quite detailed depending on where you work, what the PPE guidelines are, and it would be our goal that be in effect as soon as possible.
We have time for one more question.
Ms. Saragusa, Bartley Daviser at CBC. How many of Winnipeg's 150 public health nurses are working full-time on COVID-19?
I'll ask the public health expert.
Yeah, I don't think I know the proportion of that exactly. I'm sure there's other issues that still need to be dealt with, but certainly COVID-19 is the priority right now. But I don't have an exact breakdown of how many are working just on that.
And that concludes today's media briefing. Thank you.
Thank you.